Good morning. I'm Dr. Eugene Kolah, founder and CEO of Peri Bloom, a health IT organization that operationalizes interoperability through data standardization and patient-centered technology. I'm honored today to be surrounded with those who share a common goal, which is to reimagine healthcare, and not just as a concept, but as a living, breathing system that truly works for patients, health workforce, and innovators alike. But before that, I want to bring you into a moment of my own journey that is full of lessons learned that you can use yourselves to apply in the works that you are doing. Say, not so long ago, as a young medical student, I started a project that I believe could make a difference. I wanted to improve healthcare delivery in underserved communities. The energy was there, and the vision has always been clear. But as I got to work, reality hit me, as systems that I needed to access were locked away. The APIs were closed, and critical data sat behind impenetrable barriers. And no matter how innovative my solution could have been, without access to this critical data, I was stuck. So back then, I felt a deep sense of helplessness because with all the knowledge, training, and passion, I couldn't connect the dots. This made me realize one thing that has stuck with me ever since, that healthcare is only as good as the systems that support it. We need more than compassion and expertise. We need technology that works as hard as we do, technology that connects, empowers, and most importantly, flows without friction. Systems that are open, accessible, and designed not just for efficiency, but for people. I'm quite aware that these barriers are shared and similar. We've all seen the power of data and how it can change outcomes and save lives while also driving innovation. But often, that power is locked away, unreachable, and unusable. And this is a global problem right now. The 80% of healthcare data is sitting in silos, disconnected from the people and systems that could put it to use. This lack of interoperability costs healthcare systems upwards of 30 billion. But then again, the real cost that is harder to measure are the missed opportunities, the delays in care, and the innovations that never get to see the light of day, simply because data is in silos and cannot be communicated across them. It was during my student days that I stumbled across a solution, and this solution was the openEHR standard. I remember diving into the specification and reading these first words, that because the architecture is highly generic, and particularly due to being architect-driven, it satisfies many requirements outside the original concept of the clinical EHR. At that time, it was the early days where we had shifted from the global pandemic, and we are now thinking that the health of human beings is closely associated with the health of the environment where we are at. And that's the One Health concept. And when I read such a statement, I look at it from a One Health perspective, where I see how we can achieve standardization and equally derive care and value across all the facets of healthcare delivery. So I treated this as my second degree because I knew it promised something revolutionary. The possibility of truly vendor neutral, interoperable healthcare solution that could break down those silos that I was fighting against. To now, the specification still amazes me on what it can achieve. And the more I work with it, the more I realize that truly open standards like openEHR and HL7 Fire, among many others, are the foundation for the future we all want to build. At Peri Bloom, we've embraced these standards and have seen what's possible when systems work together. And I think back to an outbreak across Africa during the infamous El Nino, where we were able to integrate openEHR among other standards and enable community health workers manage outbreaks. See, during this time, what we did, we actually made systems that were fluid, where the data didn't just sit in one silo, but it moved, it informed, and more importantly, it saved lives. This wasn't just a success for our team. It was proof that a data-first approach to interoperability is the only way. But here's the truth. We still have a long way to go. Too many healthcare systems around the world remain trapped in silos. We are not just talking about making healthcare more efficient right now. We are talking about empowering patients, about giving them control over their own data, because in that way, we will be able to break down these silos. Imagine a world where every patient, no matter where they are or what care they need, has instant access to their full medical history, where systems aren't just barriers, but bridges, seamlessly connecting patients to the care they deserve. That's not a dream. That's what truly open standards like openEHR and FHIR are making possible right now. But we have to fight for it. We have to build it. See, we have emerging technologies like AI, machine learning, and data federation. These will help us take this even further. But none of these advancements can reach their full potential unless we all commit to making our system standardized, open, interoperable, and patient-centered. I'll repeat that again. Unless we decide to make a commitment that we are building systems that are standardized, open or vendor neutral, interoperable, and patient-centered, we cannot attain the future we want to. And at Peri Bloom, we are doing this. We are doing our part to push these boundaries. And I know we can do it very well, but we cannot do it alone. Each one of you has a role to play in building a future where healthcare isn't defined by what's impossible, but by what's possible when we work together. So, as we dig into conversations, I invite you to think deeply about the systems you're building, the innovations you're driving, and ask yourself, are they open? Are they connected? Are they serving patients first? Together, we have the power to create a healthcare system that flows like systems should, connecting the dots, and not just for us, but for the millions of people waiting on the other sides of silos, counting on us to make their care better, faster, and more human.